Thank you very much for the introduction. And well, as a co-initiator and project lead of the Joint Decision Dashboard, I am very excited and feel very honored to present our dashboard to you by behalf of our co-initiators Mark Kok and as well as Professor Angelique Wil. Which is a dashboard that we developed at our rheumatology department from the Maastad Hospital, which is one of the 7 Santion hospitals in the Netherlands. So just to start with, this is a quote that we received from one of our patients. And you can imagine that we were overjoyed when we received this message that was published in a special edition of a newsletter, where truly what we believe in came all together. So the innovation, the improvement, but also the empowerment of a patient and delivering value, as that was what she experienced in the way that we delivered our care. So as I said, I will discuss with you and share with you today about our Joint Decision Dashboard. I will show you how we achieve these outcomes and as well provide you with some tools on how you can achieve this as well. Because what we did was we developed a pro-integrated shared decision-making dashboard, which was funded by the Dutch National Institutes of Health to really support patients and caregivers in discussing the outcomes that matters to the patients as well as the clinical standardized parameters. So we defined 4 aims, and one of the aims was to accelerate the adoption of the ICHOM pros and its use in the clinical setting, so truly in the consultation room, there where the conversation happens. And furthermore, as a second part, we also introduced another one, and I see that the screen is a little bit hampering, so here it goes, perfect. What we also did, what we wanted to do was to provide transparency in the way that we provide our healthcare delivery and to give insight in the healthcare quality that we deliver by means of the use of the clinical outcomes. And thirdly, what we also wanted to do was to reinforce the true relationship between patients and the caregivers within our treatment team, because rheumatology is one of the chronic diseases, as most of you will know. And here you can see that there's a shift in what patients value more, and often that results in a relationship between the caregiver and the treatment team. And finally, what we wanted to do was to provide a framework that could be used for other diseases, but also other health institutions, and that it should be easily scalable so that others can adapt this innovation as well. So just to tap on how we wanted to deliver value continuously and also stimulate the improvements, we defined 4 key steps. So we started with co-creative innovation, implementation, moving towards evaluation, and then making a permanent change, which is a transformation on multiple levels. And I'll guide you through all these steps and show you and give you some examples of how we approach this. So first of all, we started with a co-creative innovation, and what often happens in healthcare is that we see that innovations will be initiated, but the real user group are not involved. And what we did, we involved our patients, and it was actually a question of them for how can I interpret my disease activity, which is depicted in 1 number, how can I interpret this in relation to how I actually feel? And at that moment, our care team were also experiencing the same challenges because we implemented the ICHOM standard set for inflammatory arthritis. So they were lacking, or they were in need of a framework that would support the pro-based shared decision-making in the consultation room. So in order to do this, we sought partners and stakeholders who shared our vision. So that resulted in Microsoft, Macaw, but also other healthcare institutions. And we follow the design thinking process and solely focusing on the values and the software that were already available in the hospital. So this is a representation of our dashboard. It's, as you can see, it's fully integrated in the electronic health record. And on the below panels, you can see the ICHOM standard set, or the domains that we measure, that combines also the chroms that we measure. And to prepare the patients in formulating their treatment goals or their ailments to us, we have 4 intake questions that really focuses on that to support them in communicating their needs to us. So in this dashboard, you can have a more in-depth look in what the outcomes are per specific domain. So if you have in-depth tabs, you can click on it, and then you can see how your previous value is related to your current level. And if patients also want to, they can be compared to their peer group. So that it's also an optional it's also an option within this dashboard, and then we can compare their results or their results with patients from other hospitals. We also included some interactive icons, so that when patients leave our hospital, they'll have a remote coaching, a remote coach who can assist them in the period that they are not visible in our clinic. So then this is the app that we developed, in which patients can select per domain where they are in need. And if they click on it, they will get some tips on how they can improve their outcomes. So if there are lack of sleep, or if they have ailments in their joints, then there's a video that they can play, and so that they will be empowered to support themselves and to improve their outcomes. Of course, we have a solution, but this is not the end, because it has to be implemented. And how we did this was by continuously involving all stakeholders with iterative sessions with them. But we also developed some educational materials for the patients and trained our physicians in knowing how to fully integrate this tool that we offer to them. And we also used a phased exposure approach to upscale the implementation and improve the implementation also over the time course at our outpatient clinic. And what we also did in this phase was focusing on planning the structural embedding after the project period, because often we offer solutions, but then the project is ended, and that means end of innovation. So we already looked for a structure that would be fit for our innovation. The third step that we undertook was to provide evidence-based evaluation, where we looked on all these topics. Some of them are still ongoing, so I can't present you the results till now, but we looked at the outcomes, so the pros and also the prems on the short and long term. And we also are evaluating the process, so in decision making, but also the organization. So how does this fit in the care path of the patients? And moreover, we also investigated the economical part of the innovation by looking at the time-driven activity-based costing, and also looking at methodologies that would appraise this innovation in a value-based manner. And we all do this by means of real-world data and mixed methods design. So when you get into the end, we really wanted to fix and to make this change permanent. So if I can tell you a little bit about the impact that we had on a micro level, what we saw was that our patients, they rated our care delivery with an 8.4, and we saw also an increase in the adaptation and the response of the pros reached up levels of 80%. On a meso level, we saw that also in our hospital at this moment, we have an outcome-based management dashboard that will aid the management also in in translating and in guiding our facilities and our healthcare delivery system in a more outcome-based manner. And it's also being upscaled now to other diseases within our hospital. On the macro level, the kidney failure dashboard has been developed within the Santillon, and also we have an upscaling in the Albert Schweitzer Hospital, which is also another one that supports the dashboard within the rheumatology. And the fundament of this all is a cloud-based platform, and that is also now being used by the Dutch Society of Clinical Chemistry. And we have been recognized also by the Value-Based Healthcare Prize that we won the Collaboration Award, and we were nominated for the Computable Awards in the digital transformation. And all know that we have the ambition to add the ICHOM Prize as well this year. So before I close up, I would like to express my gratitude to all of these people, and foremost our patient panel, who really are so dedicated and who also gave us insight into what their needs are. And this project wouldn't succeed without all these people putting in all their efforts and their time. My personal intention for this project and doing this project was also not only to induce change, but actually to inspire and to transform. So I want to end with this quote that change is inevitable, but transformation requires effort. Thank you.